I think a really hard truth in social work and social services is sometimes the intervention you're delivering is not the one that's going to lock in those improved health outcomes for that person. Someone comes in for rehab, and that is not the rehab experience that's going to get them healthy or sober. They come to counseling because of a trauma event, and that day of counseling is not going to be the thing that heals them from that trauma. The research is quite mixed on this, but I read one article that said people with with eating disorders, or the medical diagnosis, it can take 7 to 10 years with many attempts to become healthy. Likewise, with addiction to substances, once someone decides to change that, it can take multiple years as well. And yet, the importance of every positive touch point cannot be understated. Every touch point, every interaction, every relationship is healing and moves someone along the journey. I think that's really beautiful too. Yes, it can suck if you're an addiction counselor and someone comes into your addiction facility and it's the third time. And it's like, dang, those first two times weren't it to get that person healthy or sober. But on the flip side, I can't help but think that person feels safe and secure enough to come back to you for another touch point, for another point of the relationship, for another interaction that moves them on their healing journey. And I think this is an important narrative to share because I think of medicine, right? Where it's like, okay, you're sick, so you go, you take a pill, and 7 days later, you're better. Or you get injured and you go for one surgery, and then after a month of recovery, bam, you're done. Or we also see this in the weight loss industry, right? Like just these befores and afters that make it look like, bam, you do, 1 year of intermittent fasting and working out, and now you're shredded. And that's the goal. That is not always the case. Living a happy, healthy life and having healing interactions, it does involve many small touch points and relationships. And I think that's beautiful. And I think that's worth reminding folks. That is a core part of social work.